So here we are talking about the public health risks of tornadoes from Chapter 7 of the Public Health Emergencies book. Tornadoes represent one of the most serious weather-related threats to public health. Over the past decade, they've caused more fatalities than any other weather hazard in the United States. They generate strongest wind speeds ever recorded on Earth. Beyond immediate injuries and deaths, tornadoes can devastate infrastructure that people rely on every day. Homes, shelter, systems that provide clean water and safe food, facilities that deliver medical care. The impacts don't end when the storm passes. Survivors often experience both short and long term psychological stress as they deal with injuries, loss of property, disrupted livelihoods, and in some cases, the loss of loved ones. From public health perspective, tornadoes are not just acute disasters, they create cascading physical, social, and mental health consequences that require coordinated preparedness and response. Tornadoes are violent, rotating columns of air that form from thunderstorms and can generate winds up to 300 miles per hour. They can cut wide, long paths of destruction. Their severity is ranked using the enhanced Fujita scale, which ranges from EF0 to EF5, and is based on the estimated wind speeds and observed damage. To better understand the risk and guide preparedness, the National Weather Service's Storm Prediction Center maintains detailed tornado data on intensity, location, timing, injuries, fatalities, and property damage. All that information is essential for public health planning and emergency response. As we can see here in this graphic, tornado risk is in the United States is not evenly distributed. Most severe tornado activity is concentrated in two main regions. The first is called Tornado Alley, which is a broad corridor stretching from Texas through the south central US, reaching north into the plains and east into parts of the Midwest. The second area is Florida, and that experiences high tornado risk due to frequent thunderstorms and favorable atmospheric conditions. Another critical concept is tornado outbreak. When multiple tornadoes occur across the region, often from storms tied to the same large weather system. While outbreaks are relatively rare, they are especially dangerous because they produce widespread simultaneous impacts that can result in high casualties. So the average lead time in the US for tornado warnings has remained pretty stable for decades, typically around 13 to 18 minutes, with modest improvement since 2012. every every one of these short windows matters. Effective warnings can significantly reduce injuries and fatalities when people receive the warnings and are able to act quickly. Warnings are issued by the National Weather Service and delivered through multiple channels: sirens, TV and radio, mobile alerts, text messages, and weather radios. But access and response are not always equal. Again, we see that social and structural barriers such as language differences, power outages, rural location, hearing impairment, disabilities like that, lack of warning devices, those limit who receives and who responds to alerts. False alarms also are common and can erode people's trust in the system. Ultimately, protective action depends not just on the warning itself, but on who hears it, where they are, what resources they have, and whether they've planned for response in advance. Tornadoes pose a severe and often indiscriminate threat to the built environment, like our homes, our workplaces, and infrastructure that we rely on every day, hospitals and so forth. Extreme winds can destroy buildings, disrupt communication, release hazardous materials, and also create long-term health risks from mold exposure, whipped up by those winds. Much of this damage occurs with little or no warning. The most lethal tornadoes, obviously the strongest ones, EF4s and EF5. Those events account for nearly 90% of tornado-related deaths. Injuries are often severe and complex, caused by flying debris, structural collapse, power outages, and disrupting critical medical equipment. Additional injuries often occur from during rescue and cleanup when people face cuts, punctures, heat stress, physical strain. The risk is not evenly distributed. Social vulnerability, again, as we've talked about before, that can be shaped by age, housing quality, shelter access, and whether people are outdoors or in mobile homes. It strongly influences the outcomes from these events. Mental health impacts are significant. PTSD and depression are common, especially among children and adolescents. That many people just can demonstrate resilience, although stigma, limited resources, lack of mental health access still remain barriers to recovery. So tornadoes can often create secondary health risks that persist long after the storm has passed. Widespread debris and water damage can promote mold growth, contaminate food supplies, and increase respiratory illnesses. In rare serious cases, fungal infections like mucormycosis can occur, especially among people with weakened immune systems. This can be life-threatening when introduced through skin wounds. Tornadoes often overlap with other public health crises, for example, like COVID-19. In 2020 alone, more than 1,100 tornadoes occurred during the pandemic, creating difficult trade-offs. People were hesitant to use public shelters, transportation services were disrupted, and response agencies were experiencing staff shortages. Those overlapping emergencies highlight the need for coordinated disaster and public health planning, clear risk communication, and adaptive shelter strategies. Recovery must also address mental health, monitoring emotional well-being, providing accessible evidence-based supports like using cognitive behavioral therapy and remote counseling. Those are essential for helping individuals and communities stabilize after the loss. Now we're going to talk about an example of a tornado that happened in Missouri. It's called in an area called Joplin. The Joplin tornado was one of the most powerful and devastating tornadoes in U.S. history. It hit as an F5, EF5 tornado with winds exceeding 200 miles an hour. Touched down southwest of the city. It remained on the ground for almost 40 minutes and carved a path of destruction almost 22 miles long and a mile wide. The consequences of that were catastrophic, with 41% of Joplin's population affected. The tornado killed 161 people, injured more than 1,000, and damaged nearly 8,000 structures, including hospitals and critical utilities. Economic losses were around 3 billion. The Joplin tornado remains the costliest and deadliest tornado in U.S. Since modern record keeping began in 1950. It fundamentally reshaped national conversations about community vulnerability, preparedness, and resilience. Despite the extreme devastation, the Joplin tornado was actually pretty well monitored and warned about in advance. The National Weather Service had issued a tornado watch for southwest Missouri early that afternoon, followed by a warning for Joplin about 17 minutes before the tornado touched down. That warning window represents a critical opportunity for protective action, even though the outcomes were still catastrophic. After the tornado, public health monitoring shifted to tracking deaths, injuries, and and health impacts. Recovery teams documented fatalities while the Missouri Department of Health used the Essence syndromic surveillance systems, which looks at emergency department data related to tornado injuries. Essence helped identify injury patterns and emerging health concerns, but also had limitations. It only captured people who actually sought out medical care at the emergency room and provided limited detail about circumstances. But this highlights how our early warning systems, syndromic surveillance systems like Essence, and trained frontline public health workers are all essential for situational awareness before, during, and after large scale disasters. After the Joplin tornado, public health response quickly expanded beyond trauma care to address emerging physical and mental health threats. Local health agencies like the Missouri Department of Public Health and the CDC worked together to detect and investigate cases of cutaneous mucormycosis. That's a rare but deadly fungal infection linked to contaminated wounds. Surveillance on the surveillance in the hospitals and labs identified multiple cases, and public health officials are urged anyone with unhealed wounds to seek immediate care, underscoring the importance of rapid post-disaster disease detection. At the same time, mental health needs became a long-term priority. Studies of Joplin residents highlighted the need for sustained monitoring, outreach, and referrals about the disaster. School-based counseling, small group interventions, and community mental health referrals were used to support high-risk populations, while recognizing that promoting mental health services require sensitivity and trust. Finally, training frontline workers proved critical. With guidance from SAMHSA, updated stress and grief resources help responders identify those in need early enough to connect them with timely, appropriate care, showing how workforce preparedness directly shapes recovery outcomes. Health and risk communication had played a critical role in helping residents understand risks and make informed health decisions, as well as connect to needed services after the Joplin tornado. The task was especially difficult because communication and infrastructure was badly damaged, as you might imagine. Phone systems were overwhelmed, coordination between agencies and the public was disrupted. In response, officials rapidly restored communication using satellite uplinks, radio systems, ambulance radios, and digital tools like texting, social media, and the internet. Multiple institutions contributed coordinated messages. Federal agencies shared information on health services, benefits, stress management, disease monitoring, while social media platforms were used to disseminate real-time updates on health risks and resources. Public education became especially important when the water system failed, prompting boil your water advisories and community-wide education about contamination risks. Throughout this process, frontline public health staff were central, be as trusted, but as trusted educators, requiring strong communication skills, cultural competence, and coordination across agencies to support recovery. The Joplin tornado incident was a good example that highlights the power of the whole community approach. And this emphasizes collaboration across public agencies, private businesses, nonprofits, and residents themselves. FEMA recognized that no single sector could manage the recovery alone. Public health outcomes depend on restoring community infrastructure and health systems together. In Joplin, public and private sectors coordinated closely to deliver material, emotional care, and long-term rebuilding. Restoring public services was obviously a top priority. City officials streamlined debris removal, relaxed some building regulations, and adjusted zoning laws to speed the recovery. The state and FEMA helped provide major financial assistance, including temporary housing, funding for debris removal, and occasionally temporary schools were set up. So the whole community approach led to a broad participation from a lot of different agencies. Nonprofits provided food, shelter, counseling, and childcare. Insurance companies from the private sector, they helped issue advance payments, and businesses nationwide contributed funding and support. Public health workers served as trusted connectors. They helped build relationships, identified needs, and helped empower residents, while program managers focused on coordinating partnerships and dividing responsibilities across sectors. Response planning translated policy into action. Local public health plans were designed to guide practice and protect community health. And after the tornado, the Joplin City Health Department quickly developed a 100-day plan for restoring vital services. The department staffed the Emergency Operations Center to help coordinate health administration. It worked with the EPA on air quality monitoring and reducing disease risk through mosquito control. Response planning also extended beyond human health. Animal control teams working with partner agencies and the Humane Society transported more than 1,300 pets to emergency shelters, established temporary animal triage clinics, conducted rescue operations, and managed trapping and recovery of animals and debris. Implementation depended on people. Frontline staff carried out policies, gathered feedback, and clarified roles across partners while building working relationships. Program managers coordinated across agencies, balanced multiple policy considerations, and aligned diverse efforts, turning plans on paper into a functioning system-wide response. After the tornado, protecting public health required more than just emergency care. It required policy leading to action. Laws, regulations, ordinances at the federal, state, and local levels were reviewed, enforced, and in some cases temporarily waived by the Missouri governor to speed recovery and support community well-being. A major innovation was the creation of the Missouri Recovery Resource and Rebuilding Center through Executive Order 1117. This permanent centralized center brought together staff from more than a dozen state departments to function as a one-stop shop for tornado-affected uh, residents. It streamlined access to services, improved communication with residents and agencies, and supported objective evaluation of the recovery efforts. Frontline staff helped residents secure temporary housing, employment assistance, and replacement identification as needed while navigating complex bureaucratic processes. Just as importantly, they fed real-time lessons back to public health program managers informing improvements in laws, regulations, and enforcements to better meet the ongoing and unmet public health needs. In the aftermath of the tornado, the local public health system worked closely with the health department and community partners to understand who needed what and why some people couldn't access care. That meant identifying the specific needs of different population groups and uncovering barriers such as language, culture, mobility, and system access. Public health then coordinated with other service sectors to deliver targeted, ongoing, and culturally linguistically appropriate care, with special attention to vulnerable populations affected by the disaster. At the same time, the healthcare system itself was under strain. St. John's Regional Medical Center was severely damaged, resulting in 6 deaths, gas leaks, flooding, and total power loss from the tornado. Critically ill patients were transferred to another health system. Triage was conducted in parking lots. Temporary care sites were set up across the community, and emergency generators helped allow life-saving surgeries to continue. This response reinforced a core lesson that effective recovery depends on recognizing inequities in real time and designing services around the lived realities of different communities. After the Joplin tornado, multiple federal agencies conducted detailed evaluations to understand what worked, what failed, and why. FEMA's lessons learned study highlighted strong, timely emergency response, effective communication, and solid coordination across federal and local agencies, but also emphasized the need for better coordination and a more deployable, trained workforce during large scale disasters. The National Weather Service confirmed that warnings were issued on time and information was effectively communicated, while noting that public response is shaped by factors like false alarms, trust in warnings, and compliance. Hospital Hospitals, researchers, and public health managers reinforced another key takeaway: the data-driven evaluation, dependable communication, sufficient supplies, and regular exercises matter more than written plans alone. These are essential for improving recovery after future disasters. The unusually high death toll in Joplin wasn't just about the strength of the tornado, it was also about human behavior and preparedness. Many residents either ignored the warnings, they didn't get them, or they failed to act uh, in a timely manner. Some of them didn't perceive their personal risk. They couldn't confirm the tornado's existence or assume their area wouldn't be hit. Recent false alarms further eroded that trust, while the tornado's massive size, uh, long path, and strike through densely populated areas amplified the damage. Comparisons with the Tuscaloosa tornado show how preparation matters. Joplin residents were less likely to receive warnings and relied on fewer warning sources, reflecting weaker preparedness. In Joplin, social factors like education, gender, and having emergency plans shaped warning access and action, while in Tuscaloosa, warnings were more uniformly received. Tornado risk and response must be understood in social and historical context. Communities with less experience and lower preparedness, like Joplin, should be prioritized for targeted public health planning. Stronger warning systems and sustained investment in research, data sharing, and frontline training. So to sum it all up, tornadoes are a frequent hazard in the United States, and their public health impact extends far beyond immediate injuries and death. They can trigger cascading events like infectious disease risk, toxic exposures, mental health challenges, as well as damaging infrastructure widely. While modern weather radar systems often provide reasonable lead time, access to those warnings and people's ability and willingness to take protective action remains one of the biggest public health challenges. Structural damage, disrupted health care, and utility failures compound the risk during and after the event. The key lesson from tornado case studies like Joplin is that recovery depends on more than emergency response alone. Damage to healthcare and critical utilities creates unique public health challenges, and effective recovery requires strong coordination across public health, emergency management, healthcare systems, and private sector partners, all needing to work together to restore essential services.